Next, we'll have Dr. Paul Leithart of Columbus, who will talk on what patients would lose in the United States.
Thank you. It's been a real pleasure to be here the past several days and hear these inspiring addresses and to meet some of you. I've enjoyed it tremendously. I must say I'm getting a little self-conscious about my speaking. I have been allotted 5 minutes to deliver this dissertation to you, and it reminds me of what happened a month ago. I was speaking to a group of ladies. They asked if they might first have their business meeting. I thought this was fair. The main topic of discussion was just how they might raise more money. And the crux of the matter was they wanted to raise more money because they wanted to get better speakers. The idea that Americans might lose something under a program of national health insurance would surprise many citizens. Few Americans want socialized medicine, but somehow in our contemporary somatic jungle, national health insurance is not socialized medicine. It's different. It's just simply insured care, and there will be no more medical bills. Somebody else is going to pay for the doctor's care. However, I think even a very casual perusal of government intervention in other areas should serve as a warning. We could take the poverty program, for example. Now, the OEO is determined to wipe out poverty if it bankrupts everyone. We could think of the urban renewal program. We might think of the post office, as has been mentioned, or the wonderful machinations of the Department of Agriculture. When the federal government dominates a field, lo and behold, presto, an army of bureaucrats appear, costs skyrocket, controls mount, restrictions are instituted, and of course, services must be cut back. Then it's bound to happen, the program flounders. Suddenly into the sequence, a presidential commission is appointed to determine the cause of this unheard of mess. Congressional investigations follow. And of course, studies reveal from all of these sources that the main problem is a lack of funding. Money is needed. And of course, also that down underneath there's a sociological trauma in society that is underlying this. And so new laws are hastily enacted, and the whole schizophrenic merry-go-round goes merrily along. Now, would government control of the so-called health industry escape from such a sequence? I don't believe so. Well, just what does the patient lose when the land of the free adopts political medicine? I think foremost is personalized, quality medical care. Doctors become preoccupied with rules and regulation, with piles of paperwork, and the mutual rapport, which is so basic in a successful doctor-patient relationship, is totally disrupted. Quality medical services are impossible. Quality medical services are impossible with government inspectors peeking over the doctor's shoulder. What individual will bear his inner conflicts, his fears, to his doctor when he discovers that these are likely to be inspected by numerous government snoops? Already, privileged communication between the doctor and his patient appears doomed in America. Quality medical care is impossible when bureaucrats determine which medicines may be used and which are banned, when modality of treatment, frequency of visits, hospital versus home care are determined by clerks who know nothing of the individual person's problems and needs. Quality medical care requires a free exchange between the doctor and his patient, a mutual respect. Any program controlled by politics and politicians will destroy this relationship. When a patient is not personally responsible for his fee, his attitude changes. Some will overuse the so-called free services and take the doctor's time unnecessarily. This will interfere with the care of those who really need more immediate attention. This overutilization, as we call it, is inherent in all government medical schemes and leads to greatly increased costs. The hordes of government clerks that are necessary to operate and police these programs further multiply the costs. Then briefly we can say that overutilization of services, the costs of the program administration, and political corruption will mean an astronomical cost for this new government health insurance. As a starter, it is estimated to cost, that it will cost $2,000 per family of 4 per year, and this is only the beginning. But more important than that even is that it's bound to lead to a rationing of services, as Dr. Quinlan has mentioned. Less time with your doctor, longer waits to see him, delays in getting into the hospital, and limits on the use of more expensive drugs and other facilities. You probably heard the term cheap politician. I want to tell you there is no such thing. As a matter of fact, I think that politics is the only profession which requires no preparation. But then, of course, the politicians say that most doctors feel the pulse before they feel the pulse. But under any political scheme, many citizens will refuse the so-called free care because they know that it is going to be second-rate. They then pay twice for services, first in taxes and inflation, and secondly for a non-government or private doctor's service. Medicare and Medicaid have amply demonstrated that political medicine is bad medicine. Let us be unswerving in our determination to retain the world's best medical system, the lower cost, higher quality, free enterprise practice of private medicine. Thank you.
Thank you, Dr. Leithart.